Hello there. Welcome everyone to the Boss Body Podcast. This is Sarah Haas. I am so glad you're with me, and I am really excited to introduce my guest today because Susan Salinger, who is the author of what I consider a really important book. It's called Sidelined: How Women Manage and Mismanage Their Health, which I think is a topic that is not discussed enough, that needs to be discussed a lot more often. And so I am so excited to have Susan on today to talk to us about her book. Susan, welcome.
Thank you so much. And it is an important book. I'll second that.
Yeah, absolutely. It's wonderful to have you. So, first of all, tell us just a little bit about you and, your background as an author and how you came to land on this particular topic.
Oh gosh. Well, I've been writing for years. This is my first book, actually, but my husband and I were in business together, and we produced corporate training films. So I wrote the scripts for the films. So I've been a writer for 1,000 years. But what happened is, after I retired, which maybe lasted about 3 seconds, that was the wrong decision for me. And so I went back to school and took some anthropology classes, mostly medical anthropology. And I realized that there's so much medical information that really never gets out to the public, and that I was hearing stuff that I thought women needed to know. And then, as it turns out, for one of my classes, I did a project on women who had had hysterectomies. And many of the women, about 3/4 of them, had undergone the hysterectomy, but really weren't sure that they needed it, and had decided to go forward with it anyway. And I had something similar. I never had a hysterectomy, but years ago I had agreed to just some exploratory surgery. I had changed medication and was having symptoms, and the doctor said, let's go in there and see what's happening. And I knew I didn't need it. I knew it was the medication, but I too had agreed. So between my own experience and then these hysterectomy women, I just wondered how, as women, we make our medical decisions. And I thought that was a really good question I wanted to answer. So then I interviewed a bunch of women and talked to them about their illnesses and their decisions and all of that, and just sort of extrapolated 5 or 6 behaviors that, as women, we do. We're really not doing what we need to do to take care of ourselves. That's what I learned.
So what made you zero in on women in particular versus men?
Because that's a good question. Nobody's asked me that before. First of all, I am one, which and some of the reasons are just logistical. I am a woman, so I was interested. Secondly, I was far more interested in hearing about women's issues than prostate cancer and that kind of thing. But really, the other reason, and the main reason, was that in these anthropology classes, I could feel the gender discrimination that goes on in medicine. And that really bothered me. And some of it is not the doctor's fault. Some of it we contribute to as women, and I'm not blaming us. I'll get to that in a second. But there's just a lot of how do I say it? The discrimination, a lot of it is structural. Women are less involved in clinical studies. There's women researchers get publicized, get publications less. We get less research money. The whole thing is structured. I don't want to say against us, but it's sure not for us. Let's put it that way.
Yeah, I know. Before I even met you, I had read before and had learned that most of the studies they do are on white males. And right. That goes across the board for even, for the medications, for FDA approvals, and for dosing information.
Right.
And because women were considered, they fluctuate too much because our bodies go through hormonal changes and different cycles, through our lives. And so they felt like women aren't a good enough, what's the word? The baseline.
Baseline.
Yeah, the baseline to go on. So they use mostly a white male group for all these studies. So we could be taking medications that are really meant for a man who is probably larger than we are too. So there's so many factors that go into it. And
it's so
that's kind
interesting.
of scary.
Oh, yeah. No, it's so interesting that you said that because, gosh, this was years ago, just a personal experience where my daughter had to have one of those gastric tests, gastrointestinal tests, and you swallow a bunch of whatever you swallow. And so they gave her this bottle and they said, drink it. And it turns out it's the same bottle for everybody. So somebody huge, let's say OJ Simpson, would have the same dosage as my 95-pound daughter. And I said, Lisa, don't even bother, just drink half of it, you'll be fine. And of course she was. But there was a whole big scandal. Do you remember the Ambien scandal? Where it turned out that women were taking Ambien for sleeping, and it had only been tested on males, and it lasts in our bodies longer than males. Anyway, to make a long story short, they cut the women's dosage by half. So if you shouldn't be taking Ambien altogether, but if you are, don't take more than 2.5, maybe 5 milligrams. Check with your doctor, because
Yeah.
it really was pretty much tested on males. But
So tell me a little bit more about the discrimination piece. Like you said, we're not saying doctors are discriminating. We're not saying, that it's someone at fault. It's sort of just the way the system has
yes,
become set up and the way medical school teaches doctors to go about things. But can you kind of explain that a little bit?
yeah. Again, I want to repeat because it is interesting to me. We, as doctors, all of us know less about women's bodies than we do as about men's bodies. And that is because, for example, women's diseases get less research money than men's. Prostate cancer gets far more money than uterine cancer. I won't say breast cancer, but uterine cancer, cervical cancer, ovarian cancer, those are more fatal, but it's the prostate cancer that gets the money. And male researchers, as I mentioned earlier, also get much more grant money than female researchers. And female researchers publish less. So the how do I say it? The news about women and women's diseases is not out there in the same way as it is about men's. And then there's perceptual bias. Now, this is part that's not structural. But for example, when men and women presented with the exact same cardiac symptoms, and there was no discrimination. They both were given an prescription for a cardiac workup. But then as soon as the word stress was mentioned, only 15% of those women received a cardiac diagnosis compared to almost all of them before. So I think that because we know less about women's diseases, I think that we're also given a more apt to get a psychological diagnosis. And we contribute to that as well. Because when women describe their symptoms, we describe them differently from how men do. Men are very succinct, objective. I mean, for a silly example, they'll go in and say, oh, I just have a sore throat. Whereas women, and I'm as guilty of this as anybody, we tell the whole story. I talk about how I have a sore throat and it's making me exhausted and I can't work and I can't do this and I have no appetite. By the time I'm done with my litany of symptoms, the original symptom probably got lost in the shuffle. So it's not only the doctor. I mean, it's hard for the doctor to pick out what's really necessary.
Yeah.
Did that kind of
There's
answer you?
yeah. So there's really two parts to this. So there's the doctor who, a lot of times we're presenting with these symptoms,
Right.
but it gets blamed on hormones or it gets blamed on stress or, that's kind of that old fashioned, women
Yeah.
are emotional, a lot
Yeah.
of things back in the old days were called
Yeah.
hysterical.
Yeah.
And these were
Absolutely.
actual medical problems that were going on, but they blamed it on hysteria.
No, that's so true. And
Yeah. And so this is sort of the modern day example
well,
of
and I
that.
think what complicates the issue, I mean, there's even more, which is, first of all, women do suffer from depression and anxiety more than men do. So while your doctor may be blowing you off, on the other hand, he or she may be exactly right. So it's hard for the doctor to know. What I didn't realize until I took these classes is there's about 30 or 40,000 different diseases out there. Diagnosis is tricky. So if you go in with general symptoms, like I said earlier, you're tired, you have no energy, you have no appetite. I mean, those symptoms can fit, my gosh, 40%, or I would say 70% of all the diseases that are out there. So for the doctor to land on the right one, it's not an easy task. And I think that's important too.
Yeah, if anybody has ever gone on WebMD and typed in your symptoms, it could be
Yes,
anything from
it's true.
digestive issues to a brain tumor for any
Yes.
one
Oh,
symptom.
absolutely. Absolutely.
So yeah,
It's
we're not in any way blaming necessarily doctors, but tend to be this
yes,
gender bias,
yes,
and
there is.
I know that a lot of things slip through the cracks for women, and you can probably speak to this a little more, but I know that when women go in with cardiac issues and they're having maybe a heart attack, the symptoms sometimes present differently than with men.
Yes.
And so they're often not diagnosed, or they don't even run the tests because they don't necessarily suspect it's the heart. I've heard that that is kind of, prevalent, which is really
I've read
scary.
that too. And one of the things I read, which I just, because I'm older in particular, but I memorized for myself, is if you go to the emergency room and you think you're having a heart attack, or you think it could be a heart attack, you want to insist on having an electrocardiogram, because symptoms present differently, because heart attack symptoms, for example, could mimic maybe a stomach ache. A lot of women are sent home with and told that they have indigestion. So you really want to, the only way to really tell is to get an electrocardiogram and try to insist on it if you can. I also learned, and this is why I'm saying this so with such what I'm so sure about it, is that you have about 4 hours if you are having a heart attack, you have about 4 hours before heart muscle damage can occur. You don't want to waste time. You don't want to lie there and say, gee, am I having a heart attack or am I not? You want to just immediately get some help. It's better to go home and find out that it really was a stomach ache than to do some serious damage to yourself.
Yeah, and that brings up the other side of things that you had mentioned, was that we as women don't necessarily advocate for ourselves. Maybe we're embarrassed, maybe we're not wanting to trouble everyone, and we're thinking, no, it's probably not this. I'm not going to bother going to the ER. Or if, hey, well, the doctor's saying no, it's probably not. So what
Right.
do I know? Let's just go
Exactly.
with what he's saying, or she. I shouldn't,
Right.
I shouldn't
Yeah. No,
assume the
yeah.
doctor's a male, obviously.
Yeah. But I think the most important thing and the most important chapter in my book is on getting second opinions. And women just hesitate to get, I think all patients probably hesitate to get them, but women in particular, we don't want to be rude and we don't want to hurt the doctor's feelings. One woman told me she was so afraid she'd be labeled a bad patient and that would be put on her record, and everybody, so she didn't want to get one. But really, as I said, there's so many different diseases out there. And then there's perceptual bias. I mean, we all see what we expect to see. And the same symptoms can be joint pain to a rheumatologist, stress to a psychologist, stomach issues to a gastroenterologist. I mean, it's hard. You see what you expect to see and what you want to do, particularly if your prescribed treatment is serious medication or surgery. You want another opinion from someone who has been trained differently from your original doctor. It's probably better not to go to somebody in the same office. It's better if your doctor was trained at UCLA, get somebody trained from Harvard. I mean, you want a whole different perspective, because a diagnosis is really a particular doctor's perception of what you have, and you want a different doctor's perception.
Absolutely. Yeah, absolutely. Because it's all point of view, it's training. They
Absolutely.
might specialize in one area, or they might have just be, very well read on a certain subject, or who
Exactly.
knows, like getting as many eyes on something as possible
Right.
obviously is always going to be beneficial.
Yes.
And what you said about not wanting to be a bad patient or not wanting to hurt people's feelings, this is your health, this is your life.
That's right.
This is important, and it's hard to stand up for yourself, especially as women. We've been trained not to ruffle feathers. We've been
Exactly.
trained to be enjoyable and pleasant and easy and not difficult.
Oh,
And
absolutely.
it's hard to break out of that, especially when you're in, I think, when you're in a medical setting where the doctor is such an authoritative figure.
Correct.
And it can be a little intimidating. And different doctors have different personalities, but some of them are kind of like, no, this is right. This is the way, period. Here's what you need to do.
Right. Yeah, no, exactly. And I think that one of the mistakes that as women we often make is that we think of a second opinion as challenging the doctor. And I think a better or a more sophisticated framework might be confirming what the doctor's opinion is. I also found out, which I didn't realize, that 1 in 3 doctors will be sued at least once during their medical careers. So for a doctor, a second opinion is also valuable because it's legal backup. Particularly if the opinion is confirmed, and I don't know how your insurance works, but if you need to get a third opinion, that can happen.
Yeah.
Um,
And I think most doctors appreciate you getting a second opinion. We're afraid it's going to hurt their feelings, but it's
yeah,
not. It's not. And I say, if you do have a doctor who doesn't want you getting a second opinion, then you need to find a different doctor.
that's exactly what I say. And
I
I've been
know when
yeah, oh, absolutely. I've been on several podcasts with doctors, and they all say that they like it. First of all, nobody wants to treat a patient for a disease they don't have. And as a patient, you don't want to take medication for a disease you don't have. You want to be darn sure that your diagnosis is as accurate as it can possibly be.
yeah, so it's a win-win
Mhm.
on all sides. I know I had breast cancer back in 2019,
Yeah,
and my oncologist immediately said, here's here's my regimen, this is my diagnosis, this is the treatments, that I recommend. You should also get a second opinion to make sure that you're comfortable with it, to make sure this is how you want to move forward. And I really appreciated that.
oh yeah,
I mean, that made me feel comfortable, and I did get the second opinion, and the doctor who I went to concurred with the first doctor, so I felt great
of course.
about the treatments I was going to be getting and moving forward. And
Yeah,
like you said, women are getting hysterectomies, we're getting surgery, exploratory
yes,
surgeries,
yes,
and that is a major trauma to your body. That's putting yourself through something really big.
yeah.
So we got to take this seriously and, stand up and advocate for yourself, because you don't want to go through a surgery just so you don't hurt someone's feelings or because you're afraid to
And
speak
in
up.
a sense, that's what I did. And I couldn't believe it when I knew, and of course, they found nothing in my case, and which I knew that was what they were going to find. I mean, I had so many options. I was young at the time. I wouldn't do that today. Um, but you're right. It's your body, and you want to be in charge of it. That leads me to something that I do want to bring up. I don't want to run out of time. I think it's very important to do your own research. I want to say 2 things about that. Number one, I always get the clinical name of my disease. I actually have the doctor write it down so that I can come home and look it up. Because I mean, getting it is one thing, spelling it can be something else again. So I have them write it down for me, and then I go on, the web, and of course, a lot of that information is inaccurate, but a lot of it's accurate. In my book, at the very back of it, there's a whole resource section, and I've done your research for you. I give you the legitimate websites. Excuse me, there's my cough. I give you the websites where you can look up your symptoms, look up your disease, check your hospital if you have to have surgery. Some hospitals specialize in cardiology, others are better for neurology. So it tells you how to do that. And I think that that's a very important thing to do so that you're on top of what is happening and, more importantly, what should be happening. So use
Yeah.
that resource section. I worked really hard on
Oh, I
that.
appreciate that, because it is kind of hard to know what's reliable, what's not. You don't want to be getting misinformation. But when it comes to just researching a disease, what is it? What causes it? What are some of the options for treatments? you can get pretty good information out there.
Absolutely.
And, you
Absolutely.
can look at a number of different sites. And if they're all sort of saying the same thing, then you're on the right track. And another thing that I do is look for actual studies, research studies that have numbers and control groups and conclusions, because I know that's legit.
Yeah, no, I'm with you. It's interesting you said that, because as I was writing the book, one of my friends had breast cancer, and she said, well, I said, well, now be sure you research. She said, well, how do I do that? And so my resource section was born, because you do want to get the correct studies, the accurate studies. You don't just want somebody, saying something that isn't accurate.
Mm-hmm.
Say something else, and I don't remember. But anyway, it's just really important.
The other thing that I was going to say, and I'm not sure if this is something that you cover in your book, but it's a point that I think is important, is also going with your intuition. We know our bodies speak to us. Mm-hmm. Personally, I had a mammogram 1 month before I was diagnosed with breast cancer. Oh, and wow. I had a mass that was about the size of a golf ball. And the mammogram said it was normal. It was a cyst. Everything's fine. But my body was feeling uncomfortable. I was experiencing pain. It was calling to me. Yes. After that. And so I myself went back and said, this is making me very uncomfortable. I know it's a cyst, but what can we do about it? Or, what needs to be done here? I didn't intuitively think, okay, this is breast cancer. Right. But I knew, okay, I don't want to just go home and do nothing. Something needs to be done here. Right. They sent me for an ultrasound and a biopsy, and it turned out to be a huge breast cancer tumor, which was stage 2. It had gone into my lymph nodes. Now, if I had not gone back, if I had not intuitively, just listened to my body, to my intuition, who knows? Exactly. They caught it at, it would have been better if they caught it at stage 1, but stage 2, not too bad. They were able to get rid of it. I'm completely healthy. But if I had not insisted and advocated and gone back a month later, wow. The outcome could have been a lot worse. And so I think that's another thing. I mean, I'm not saying we can diagnose ourselves or anything like that. I'm saying if you have a niggling feeling or pain or something that's persisting, keep going back, keep asking someone else. I think that is the
best advice.
Yeah. I do. Yeah. And the other thing that I would say is, and this kind of goes back to the second opinion type thing, but I knew someone who had a medical issue, and they had done some surgeries, they had done some things, and it wasn't better. It had not solved the problem. Mm-hmm. And the doctor said, I'm sorry, there's nothing more we can do. And she told me something that I have really put to, really ingrained it into my mind. When a doctor says there's nothing more we can do, what that really means is there's nothing more I can do.
Yes, exactly.
That doesn't mean there's nothing out there.
Right.
That means there's nothing more that person, that specialist can do. Right. That doesn't mean that there aren't other avenues to explore. There's alternative therapies. There's specialists. There's, don't just accept there's nothing more that can be done, because that is not true.
I think we should even stop at don't just accept. In the book, Rita Wilson, Tom Hanks's wife, talks about her breast cancer diagnosis. And I mean, she really had a problem in the sense that the first doctor said you have cancer. The second doctor said you didn't. And I don't remember if she went to 4 doctors or 3, but it finally turned out that she did. I mean, she just wasn't sure. And a friend of hers said, I think you should get it checked out one more time. And of course, fortunately she did. But so it really isn't. And it's so easy to just say, well, the doctor said I'm okay. I just want to go home and forget about this and get on with my life. And it just doesn't always work that way. You must listen to your body. And if I had, I would not have had the surgery. I know when I take medication of any kind. I'm very small. I'm sitting down. You can't tell, but I am. And my body really just doesn't agree with me. If I take a Dristan for a cold, excuse me, I'm out for 24 hours. It's just who I am. So to change medication and develop symptoms, it seemed like a no-brainer. And of course I was right. I should have listened. You're absolutely right. Don't ever just accept.
Yeah.
Until you have to. In an emergency, you have to. We better include that because
obviously, yes. Yeah. If it's an acute, and they say you need your appendix out right now, or it's going to burst. Yeah, obviously.
Right. Yeah. If you're hit by a car and lying in the middle of the street, don't worry about a second opinion.
Right, right. But the medical system can be so intimidating and so hard to navigate. Sure. And we're just not educated. I didn't know anything about breast cancer until I got it and started researching. And now I have all this knowledge and I try to help anyone I can prevent ever having it. And then if they do, helping them, know what steps to take and that kind of thing. But it's just so overwhelming. And so I think the points that you're making are, it's really just empower yourself.
Yes.
Know that this bias exists. Know that the system is not set up necessarily in our favor.
Correct.
And do your research. Right. Get your second opinion. Listen to your own intuition.
For sure.
And speak up. Speak up and ask for and insist for what you want and what you need.
And one more tiny thing, which is make sure you stay on top of all of the preventative things you can do. Get your mammograms like you did. Get pap smears. Get whatever it is you need to get. Don't let it. I have a friend that has stage 3 or 4 breast cancer because she didn't have a mammogram for about 4 years.
Yeah.
So she wasn't as lucky as you.
Absolutely. And in most cases in the US, we're great at diagnosing.
Yes.
That is a big strength of our medical system is diagnosing. So, I'm not in any way saying, oh, don't get a mammogram because it didn't catch mine. Oh, absolutely not. Because in most cases, the tests we have, the technology we have is fantastic at diagnosing.
Yes.
So thank you. Yes, this has been such a great conversation. I think this topic is really, really important. So I want to encourage everyone to read your book. It's called Sidelined: How Women Manage and Mismanage Their Health. And if they're interested, tell me where they can find that book.
Actually, in almost any bookstore, or they'll order it for you. It's on Amazon. It's on Bookshop. I think it's bookshop.org, indie books, whatever. Great. But Amazon is where most people seem to go, which is a better word. That's
for that and everything else. Yeah, we could talk. That's a whole nother. That's a whole nother program.
No, you're right. You're right. But it's available everywhere.
Thank you, Susan. Thank you so much for being here and for the work that you did putting in to write this book and get this really important information out there.
Thank you so much. Really, I appreciate it. Have a wonderful rest of your day.
Thank you. And thank you, everybody, for listening. I'll see you again next time.